If you or someone you're close to have depression after stroke, then sit back for what might be a challenging discussion. In my work, over the last 4 decades, I've helped around 3,000 to 4,000 of people recovering from stroke. I didn't keep statistics on that part, but it's fair to say that most of those that I've worked with have experienced some depression, and over a wide range of time following their stroke. Sometimes just a few days and weeks, sometimes many months or longer. Many have been offered medication, unsurprisingly. But what is depression? And more importantly, does it even serve us a purpose? Many will have been offered medication, unsurprisingly, but what we have to think of is, what is depression? And more importantly, does it even serve a purpose? And can we do anything about it? Now, it didn't take long to say those few words, but are amongst the most controversial that I've ever said in public. Depression is bad, right? Depression's a disease, right? Depression means some kind of chemical imbalance or shortage in the brain, right? But what if depression could actually help us? Depression is a feeling, or perhaps more accurately, a lack of feelings, and it occurs when things are, by and large, going badly. Of course, I'm aware that there are exceptions to this. For my sins, I've also worked in mental health settings, both here in the UK and abroad. So it does also tell us when we have made a mess of things. And hopefully, with local support from family, friends, and medical staff, you can begin to make inroads into the gloom by acknowledging the problem, finding out what, for example, were contributing factors to having the stroke in the first place, and analysing whether these were dealt with early enough. The purpose is not to apportion blame. Blame and responsibility, for my thinking at least, are very different things. So then we can ask ourselves about the usual suspects. Of course, diet and body weight, smoking, high blood pressure, exercise, and alcohol consumption. And if any of these were, to the best of your belief, a part of the picture, then you might see why your brain is telling you that you've messed up. And that results in depression. And I'm not here to judge people or give them a hard time of any sort. Really, quite the opposite. For some people out there who feel they do fit into this group, you can start to make headway. And the way you do that is to make a better plan. And you might need help with that from family, or particularly those with whom you live. Especially on subjects like diet, because the secret to success with diet is about the environment that you live in. I plan to stop here and see what the questions are that arise from this, which I know will be difficult for some, and maybe enraging for others. It isn't meant to be that. It's meant to contribute to a debate, an educated debate, an informed debate. And I'm certain that on one thing we can all agree, and that dealing with depression needs work. Thanks for watching.